So with celiac disease, the only treatment as we know it right now is the gluten-free diet. So what that means is avoiding all wheat, rye, barley, and the derivatives of those grains. Oats also, and having oats have been historically something that has been avoided. However, we're finding now research is saying that pure oats are able to be tolerated. As a dietitian, my job is to help people navigate through dietary changes, whether it be kind of changes on their own or a disease state. Usually, typically, parents are more motivated to make changes for their children, to make sure that they're staying healthy or to maintain growth or prevent any further issues. So I feel like parents are more motivated for their kids to change, so they're willing to do things differently in the household. Adults, on the other hand, even with a diagnosed condition, at times are not as motivated to make changes, even if they're presented with a lot of information of the potential problems down the road. Well, first, what I do, just in general as diet counseling, is to understand what they're eating previously. So to get an assessment of what kind of choices they're making and what I need to suggest differently. So doing a diet recall or diet record to understand kind of their usual habits. Then my kind of next step is to figure out kind of the main problem areas, one being usually low fiber choices, so trying to increase fiber, gluten-free choices that are more whole grains, like for instance oats is one of them. I definitely counsel families together to make sure everyone understands where, especially parents, grandparents, other caregivers, to make sure that everyone's on the same page of what this diet entails. I provide a lot of school notes or just general kind of informational notes that parents could give to school to make sure that the food service providers or teachers understand what this diet entails. School notes may include things like providing a sample, providing snacks, that they have in emergency situations, making sure the nurse understands that they should have some gluten-free offerings. Celiac disease falls under the American with Disabilities Act, so you can have a 504 plan, or it's Americans with Disabilities. So having a 504 plan in place is an important step for children at any age to understand that their needs have to be met. So as we age, school food services, or if they're at college, a food service plan would have to help that child. Gluten-free menus are kind of more of a commonplace nowadays. There are some gluten-free menus at normal restaurants, which is great, but really having restaurants understand how to carry those out. Restaurants may have great intention to have a gluten-free menu. However, if they are not carrying out properly, it all falls by the wayside. So providing resources such as a school note, or how to manage a restaurant, or how to understand like food service options in college, when patients are figuring out what college to go to, understanding if they have some flexibility with dorm rooms, if they have a kitchenette in their dorm room, it may be a really great thing for them. I think the best way or the kind of toughest thing to understand, or toughest kind of management with celiac disease, is to figure out which products are going to be kind of usable in your day-to-day life. When you're faced with this very big task of taking away wheat, really wheat is the most important, from your diet, a lot of people just kind of go into a tizzy and to figure out to replace it with. And I think the easiest thing is to kind of think about when we're looking at our diet, fruits, vegetables, meats, and dairy products in their natural form actually are safe and they're gluten-free. And so it's just that one grain group that really we have to replace. And so thinking about it globally and understanding that there are those other 4 food groups that are always going to be safe to consume in their natural form, and just finding a bread, a pasta, maybe a cereal as an alternative, and then really just filling in the gaps with other naturally gluten-free things is kind of my best advice.